So as most of the country is enjoying grocery shopping without a mask, attending summer concerts again, I know I've got my tickets to a few shows this fall, and feeling the general freedoms of everyday life before the COVID-19 pandemic, the Delta variant is making governments reverse course.
We are still in the midst of a once-in-a-generation pandemic, battling an ever-evolving virus. And the reality is we are dealing with a much different strain of this virus than we were even earlier in the spring.
The rising threat of coronavirus variants, particularly the Delta variant, have forced governments, both globally and statewide here in the United States, to consider another round of mask and vaccine mandates. We're not out of the woods, and sadly, we're taking a step backwards. So a little bit more about the Delta variant that you're probably hearing a lot about. It's a highly contagious SARS-CoV-2 virus strain of coronavirus. It was first identified in India at the end of last year. People with the Delta variant seem to have higher levels of the virus in them, and it is studies have shown that it is twice as transmissible as the original strain of this coronavirus. And scientists have even seen some early data that highly unvaccinated regions are serving as incubators for the new variant. We are in the United States seeing a pandemic of the unvaccinated because of the Delta virus colliding with unvaccinated regions of the country. By mid-2021, the Delta variant had become responsible for 90% of the cases in the UK. And that was just at a moment when the UK was fully trying to open up and had thought that perhaps they'd beat the pandemic. So the Delta variant there in the UK was linked with another spike and a return to extended lockdowns across the country. This is the week that many in the media described as the tipping point in terms of mandates saying, you know what, if you want to come work in our organization, you need to be vaccinated. Probably the most newsworthy of these announcements was from the Veterans Administration. The VA will now mandate COVID-19 vaccine among all its medical employees, including at all veterans' health officials. The administration is being a little political about this and careful how they tread into the mandate, into anything with the word mandate. This was a test. What will the reaction be? Will people understand that these are both healthcare workers and vets, two groups that obviously need to be protected? Employees who provide direct patient care have 8 weeks to get vaccinated, or they face possible penalties, signaling what some experts said could be a national pivot to such requirements. By mandating things, by forcing people, by making it seem like people have no choice, you can harden resistance to the vaccine. If people believe that the government is making them take a drug that the FDA has not given final approval to, which is a very big talking point to people who are anti-vaccine, it'll have the opposite effect, and it'll make people even more stubbornly against getting the jab.
Will you require all federal employees to get vaccinated?
That's under consideration right now, but if you're not vaccinated, you're not nearly as smart as I thought you were.
New York City announced that the city is now requiring all municipal workers to get coronavirus vaccines by mid-September, or they have to face weekly testing. So there is an opt-out. There are an estimated 340,000 municipal workers in New York City, which includes teachers and police officers, making it one of the largest employers in the United States to issue stricter vaccines, so even larger than the VA. Out in California, Governor Gavin Newsom is now requiring state employees and all healthcare workers to show proof of their COVID-19 vaccination or to get tested weekly. Also this week, the Mayo Clinic announced that all employees by September 27th will be required to get the vaccine or required to undergo new training and agree to special mitigation protocols that include social distancing and mandated mask wearing while on campus. They employ over 4,500 physicians and scientists, over 58,000 administrative and other staff members across 3 campuses in 3 states, Minnesota, Florida, and Arizona. Florida and Arizona have been sites of lots of vaccine hesitancy and surging COVID cases. So a lot of private sector entities are looking to the federal government to learn, are vaccine mandates legal or not? So the Justice Department did put out guidance and announced that requiring these mandates is not prohibited under federal law. I think a lot of these institutions are hoping that the opt-out is more of a pain in the neck than just getting the vaccine. The White House has been asked about this, and naturally they say they don't, want to get involved politically.
And the fact that they are always going to be driven by the speed of science. They're going to have extensive data they look into. They're going to have the best health and medical experts making that conclusion. That will maintain confidence over the long term.
But there are a lot of folks who believe, both in politics and health experts, who believe that that stumbling block, that FDA sign-off, full sign-off on the vaccine, may be a way to expand the number of people who are willing to get vaccinated. Bob Wachter, who's the chair of the University of California at San Francisco Department of Medicine, he tweeted, "Wow, talk about hitting a tipping point. As each organization and industry finds the courage to mandate or strongly incentivize vaccination, it makes it that much easier for the next one to do so until all the pressure is on leaders who have not done it." Excellent point. As this rolls across industry and government, the question for each organization is going to be, well, why haven't you done it?